Welcome to Virtual Family Training for Immigrants. The instructors in the Finnish Virtual Family Training are Public Health Nurse Annina Suoyrjö and Peer Instructor Lama from Syria. This Virtual Family Training is part of the peer-based family training model for immigrants of the NITU project, which is coordinated by the Tampere University of Applied Sciences with the city of Tampere acting as its partner. The project is funded by the Asylum, Migration and Integration Fund, AMIF. It will run from 2018 to 2020. This section of the family training deals with taking care of your baby. We hope it will provide you with useful information on your journey towards the birth and your everyday life with your baby. A parent's responsibilities include taking care of their child's basic needs. A baby's basic needs include interaction with their parents. The basics of baby care include washing the baby and taking care of the baby's skin, making sure the baby sleeps enough and gets enough fresh air and food. Breastfeeding is discussed in more detail in another section of virtual family training. Parents are already given advice on how to take care of their baby's basic needs at the maternity hospital. Both the mother and father get a chance to look after their newborn and learn to take care of the baby. It's important that both parents participate in taking care of the baby. Everything you do with your baby constitutes early social interaction. Hold the baby in your arms and close to you as much as you can. Talking to and playing with the baby are very important for the baby's development. Talk to your baby right from the time they are born, even though the baby can't answer you yet. Smile at the baby, pull faces, and show different expressions. This will help your baby to learn to recognize different emotions. You can recite nursery rhymes, play, and exercise with your baby. Talking, reading, and reciting nursery rhymes will support the child's speech development. Talk to your child in your own language. The child will also learn Finnish because they will hear Finnish all around. The baby isn't able yet to express their needs in any other way but crying. The baby cries when he or she needs something. There are many different nuances to a baby's cry. Demanding crying may indicate hunger, and less intense crying may indicate discomfort. It takes effort to learn to understand the baby's crying. When the baby cries, go to him or her immediately. A baby doesn't know how to wait. Try to find out why the baby is crying. Sometimes your baby may cry even if they are not hungry. They have a clean nappy and everything seems to be fine. Then you can hold the baby close and comfort them. Often the baby cries because of hunger, a wet nappy, tiredness, or a desire for the parent's company. It's important to respond quickly to the baby's crying and try to make the baby more comfortable. If the baby is hungry, feed them. If the baby is crying out of tiredness, help them to fall asleep. If there's wee or poo in the nappy, change it. The baby may also cry because of an upset tummy, and you can help by massaging their tummy gently and moving their legs up and down a little. The baby may also cry because they want company. Hold the baby close, talk and play with them. The baby will cry the most between the ages of 2 weeks and 3 months. If the baby's crying is very intense and starts off strong and sudden, they may be in pain. Find out if the baby is ill. Some babies suffer from what is known as colic. The exact cause for colic isn't known. Usually a baby with colic will cry in the evening for several hours. Colic will usually ease off by the time the baby is 3 months old. If the baby is crying, worries you, or it's different to normal, call the maternity or child health clinic. It's difficult for a parent to endure a baby's crying when you don't know the reason for it. Ask for help. The following sentences are peer instructors' personal experience. Children are all different. One may cry a lot more easily than someone else. The child's temperament also influences their crying. Sometimes a baby's crying can feel very bad. The fact that your baby cries doesn't mean that you're a bad parent. Ask for help if your baby cries a lot. Baby's cleanliness and skincare. It's important to make sure that the baby is clean. You don't need anything else but water to wash the baby. Every day clean the baby's face, behind the ears, neck, hands and armpits, bottom. After washing, dry the baby's skin carefully, especially in the crooks of their arms, legs and neck and folds of the skin where it may be damp. You can bathe the baby 1 to 2 times a week or more often if you like. The bath water must be 37 degrees Celsius and can be measured using, for example, the bath thermometer in the maternity pack. There is no need to put any soap in the bath water. If the baby's skin is dry, you can put some baby oil in the water. If you do, be especially careful because it can make the baby extremely slippery. Always put the towel close to the bath so you can dry the baby quickly. The baby's skin will flake during the first few weeks, and this is normal. Avoid using unnecessary cream or lotion on the baby's skin as it will interfere with the skin's own oil production. During the first few months of life, there may be some red or white spots known as hormone rash on your baby's face. Hormone rash disappears on its own. Some babies have a darker spot on their skin that's known as Mongolian blue spot. It will often get lighter in color and disappear on its own later. They are normal for a newborn and no treatment is necessary. Over the first few days, the baby's urine may be very concentrated and contain urate crystals which make the wee pink or reddish. This is called brick dust urine and it's perfectly normal. During the first few days, the baby will wee a fairly small amount, but at the age or 4 to 5 days and onwards, the baby will have about 5 to 8 wet nappies a day. At first, the baby's poo will be dark in color, sticky and greenish. Bit by bit, as the baby eats more, their poo will become lighter in color and more yellow. The consistency and color of a baby's poo can vary a great deal. Usually, it's yellowish and grainy. Sometimes it can even be greenish, which is also normal. The baby may not poo every day. There may even be a week between bowel movements. Change the baby's nappy whenever needed. If the nappy is only wet, there's no need to wash the baby's bottom. If there's poo in the nappy, you should wash the baby's bottom with water as soon as possible, as excrement may irritate the baby's skin badly. Use baby wipes only if it's not possible to wash the baby's bottom with water. Baby wipes may irritate the baby's skin. The skin in the nappy area may become easily sore and red. If it does, let the baby lie on the changing mat without a nappy for a while. You can also apply baby cream or zinc cream to the nappy area. A newborn baby has a stump left from the umbilical cord. It will dry out and drop off on its own about 1 to 2 weeks after the birth. Before the stump drops off and after it has, For as long as there's any discharge, it's very important to keep the belly button clean and dry. Check that the belly button is clean every time you change a nappy, and clean it if you see any discharge. Wipe the belly button with a damp cotton bud and dry carefully after cleaning. A newborn baby's tear ducts are still narrow, which is why their eyes tend to leak and form a yellowish discharge. Clean the eyes every day with cotton wool dampened with water. Wipe the eye from the outward corner towards the nose, always using a new cotton pad. You can cut the baby's nails when the baby is 2 weeks old. Cut them carefully while the baby is asleep or otherwise calm. Cut the nails straight without rounding the edges. Nails are often softer after a bath, making them easier to cut. Never leave the baby alone on the changing table, as they may fall off. A newborn baby sleeps most of the day. The baby will sleep about 16 to 20 hours a day. Young babies take several short naps and eat frequently. A young baby's sleep lacks rhythm. At the age of 3 to 4 months, the baby will sleep about 14 to 15 hours a day. The baby will eat less and less often at night. At the age of 6 months, the baby will sleep about 13 to 14 hours a day. At 6 months of age, some children can already sleep through the night without waking up. But don't forget that babies' need for sleep is individual. At first, the baby doesn't have a regular rhythm. Gradually, the baby will learn a daily rhythm when the parents observe a regular routine with them. Meals, naps, going outside and playing that occur at the same time in the day, as well as familiar evening routines, help your child learn to recognize the difference between night and day. It's well worth teaching even a young baby the difference between day and night. Nighttime is for sleeping, and the necessary feeding and nappy changes are done then in dim lighting. If the baby is sleeping happily, there is no need to change a wet nappy. Nappies with poo must be changed also at night. Don't play with the baby at night. In the daytime, the baby can sleep in a room with daylight and with the normal sounds of living all around. Play and talk to the baby a lot in the daytime. Always put the baby to sleep on their back until the age of 6 months, or for as long as the baby learns to turn around themselves in bed. The baby should sleep in their own bed in the same room as the parents. There must be no extra padding or soft toys in the bed. A baby doesn't need a pillow. The bed must have a firm mattress. A baby born in the summer can spend the time outdoors straight after coming home from the maternity hospital. A baby born in the winter can be taken outdoors from about the age of 2 weeks. It's best to start with just 15 minutes and gradually lengthen the time spent outside. A young baby shouldn't spend time outdoors at temperatures below -10 degrees Celsius. Most babies in Finland sleep outside in the pram in the daytime. The baby will sleep better in the fresh air. In the summer, a baby must be dressed in suitable clothing to protect them from direct sunshine. Clothes with long sleeves will protect the baby. The baby doesn't like to be hot, which is why it's important to monitor the temperature in the pram. Put a mosquito net over the pram in the summer. In the winter, the baby must be dressed in several layers of clothes to protect them from the cold. Check the child's neck, not limbs, to estimate whether they are too hot or too cold. If their neck is sweaty, they're wearing too many clothes. The following sentences are peer instructors' personal experience. You can spend time outside with the baby in the summer and the winter in Finland. The fresh air and exercise will do both the baby and the mother good. At first, dressing the baby can be challenging, but you will get better at it with practice. The best way to pick up the baby is to turn them first on their side with your hand underneath. Vary the side you turn the baby to. It's good to also vary the positions you carry the baby in. This will support the baby's development of movement. Carry the baby by holding them close to your body. Don't forget to support the baby's neck until they can hold their head up themselves. We recommend keeping the baby on the floor every day for short periods of time. This is also good for the baby's development of movement. Always handle the baby gentle and with confidence. If you find yourself getting flustered by the baby's crying, put the baby down in their own bed or on the floor and leave the room for a moment until you have calmed them. Never shake the baby. It's dangerous to the baby's life. Before the baby is born, prepare at home a place for the baby to sleep. The baby can sleep in a cot or the box the maternity package came in. A bath for the baby, a pram for moving about, a car seat for the car. Think about where you want to change the baby's nappies, whether you will need a changing table or change nappies on the bed or somewhere else. Buy or acquire equipment you will need for taking care of the baby. Plenty of nappies for a baby weighing 3 to 6 kilograms is about 50 to 100 nappies. At first, you will change nappies often. Equipment for keeping the baby clean, such as cotton wool, cotton buds, baby wipes, baby oil, or a gentle basic skin cream. Plenty of clean gauze or towels. Kela's maternity package will provide you with lots of baby clothes and useful baby care equipment. You will receive your Kela maternity pack by post in about 2 weeks after you have been granted it. Everybody can learn to look after the baby. After your baby is born, you can start to get to know each other. Have confidence in your skills. In addition to having their basic needs met, a young baby needs a lot of love and closeness. Talk and smile at the baby. If you have any questions about the topics discussed here, please talk to your public health nurse at the maternity or child health clinic. We recommend you also see the other videos and brochures produced within the Need to project. Some of the videos are available with Finnish, Arabic, English, Persian, and Somali subtitles. Some of the brochures have been translated into Finnish, Arabic, English, Persian, and Somali. The employees of the Need to project wish you a happy pregnancy and all the best with your delivery.